The discussion around the advent of HIV and its devastating impact didn't escape this conundrum of race. There was this whole notion amongst white people that blacks in general either are or were promiscuous, which fed into the narrative that this was, the fact that HIV was being seen as a black disease was actually a white attack on the black persona. I hope as I go on, you'll realize why I'm starting where I'm starting. So when someone like President Thabo Mbeki, for example, was coming up with all that resistance against HIV causing AIDS, you have to understand it in the context of him seeing this as part of the general white attack on black people, this whole notion that black men can't keep it in the zip. No? So, for example, if you look at America, the initial discourse was that HIV was a non-heterosexual sexual activity-induced disease. In South Africa, the discourse was angled on race, and as such, there was what I call the two dimensions of the debate around HIV and AIDS. One was the politics of it, and the other was the science of it, where you're dealing with treatment and its effects. So in that whole politicized, race-obsessed debate, enter the media, and how HIV, people who were living with HIV and AIDS were seen as people who were sufferers. The face of this HIV was in the main black. Photographers and television crews would just go to black hospitals, and we still have black hospitals, and find people queuing for whatever health assistance that they need. But they would just snap away and come back with these pictures of these women sitting there with their babies, and there would be the following day's illustration or tonight's illustration in the news about HIV and AIDS. This would be people whose permission to be photographed wouldn't even have been requested. Whether they are living with HIV and AIDS or not, it wasn't an issue. They were black, they were sitting in a hospital, so what else could they be there for? So when a white judge called Judge Edwin Cameron came out and said he was living with HIV and AIDS, there was like a palpable relief amongst many people. So in trying to move the debate around this issue, Judge Cameron became the new face of HIV. In the papers that I was editing, for example, I banned the use of any black person as an illustration of a story around AIDS unless that story is talking about that particular person. If you were just talking generally, go and take a picture of Judge Cameron and put it there. He became my everyday symbolism of somebody living with HIV and AIDS. So any photographer who worked for me, for example, knew that they can no longer just go to a hospital and come back with pictures and say this can be used as illustration of AIDS. They would have to show me even the permission from that person who says, yeah, indeed, I grant permission for the picture to be taken. So in the middle of all of that, there was a lot of activism around the issue of HIV and AIDS. NGOs were formed. Some were very prominent, like the Treatment Action Campaign. And they brought with them a new language around talking about the issue of HIV and AIDS. So instead of AIDS sufferers, people were now people who were living with the virus. And that language permeated the coverage of the media. Prominent people like Nelson Mandela came out embracing people who were living with HIV and AIDS, which meant that, okay, so maybe if Mandela really can, it means it doesn't really matter. Maybe you can't get it by just hugging somebody. So a few years ago, Dr. Mbajiogo did a doctoral thesis which looked at South African newspapers' coverage of HIV and AIDS pandemic and audience attitudes in a particular province called Limpopo. And in that thesis, he got his doctoral, his PhD for it. He found that the media in South Africa had actually communicated high-quality HIV and AIDS news stories to the public. So he was looking even at the language and the analysis and what sort of stories was being done. And I hope the organizers here will hand out this thing so that we don't have to go through the actual findings one by one. But in essence, he found that the South African media had done well in its coverage of HIV and AIDS. But in a sense, the issue around HIV and AIDS was probably easy to do because it was this big thing that was happening. It was a big international story. And if you looked at people, you could see that they were having this problem sometimes. There was even language about people who were slimming when they were disappearing slowly. But the issue that we are confronted with here, which is what my brief was, what is it that we can learn from what South Africa did, the South African media did around HIV and AIDS coverage in relation to the debate around infertility? Infertility is private and personal. And the prejudice that we're trying to deal with, it's directed mainly towards women. But even though it is private and personal, its manifestation is public in the absence of the baby. Okaingwana, this is the big thing when you're a woman back there, say, where is the baby? And in some areas you find the granny in waiting, sort of like the mother to the husband, who would have said whatever she feels needed to be said and the baby was still not coming. She would just take maybe even a piece of wood and put it on her back and walk around carrying that. And if anybody asks, she would say, what can I do? I don't have a grandchild. And you can imagine what that does to the woman from whom this baby is being expected. I come from a little village called Chabarubedzi. It's in the Limpopo province. There's an old lady there who's probably now about 75 years old. So about 3 weeks back, I was home, and somebody else was talking about her. Her name is Bomakwarela. Now, this other person says, which Bomakwarela are you talking about? Are you talking about Bomakwarela who doesn't have a child? She's about 75 years old, but the only defining thing insofar as this other woman is concerned is the fact that Bomakwarela doesn't have a child. This is about 3 weeks ago. And it just hit me that this is so bad. I remember a few years back, a cousin of mine and his wife had been having problems. They didn't have a child. So eventually they went and adopted. So some other girl was being funny, and this woman was scolding her. And this one says to her, "I don't talk to a woman who can't give birth." This is a small child who's saying this to this woman. And this woman just walked away, went home. This is a few years back. It stayed with me because I could see the pain that is there. So even from where I live as a man, I have a bit of understanding of how difficult a life can be. So the media's role in this instance would be limited to discussions around the causes of infertility and societal attitudes. But as I was saying last night, the faces are far in between that you need to tell the story. Because people hardly want to talk about how they are grappling with issues. And that is why what Mulatelo has done, which is the documentary that I'm told will be shown when I finish speaking here and we finish with this afternoon's session. There'll be the screening of her documentary where she documents her entire struggle to get this baby that she didn't get. But you need those faces and those voices that speak from inside. Not Mathatha, who has 4 children and a wife and whatever, we are okay, and I'm sympathetic. That helps maybe in getting resources to get the campaign going. But in order to actually reach people, you need people who speak from what Jimmy Cliff would have said in his song, "Who feels it, knows it." Last night I spoke about the issue of the dwindling media economies and the fact that in many newsrooms specializations are dying. It's what we call back home one-man mbuto. So one person must go out and do virtually everything, and as such, the in-depth coverage that would be needed if we are to succeed with a program like the one that we are trying to do here, it's going to be difficult. Already in South Africa, many of the in-depth stuff that is being done, whether it's around health with an institution like the Mail and Guardian where they have a unit called Bekisisa, it's all funded by donors. Amabungane, which is an investigative unit that has been responsible for all the political coverage that brought Zuma down, all of that work, it's funded by donors. The publications themselves can no longer afford long-term investigations that take 2 months, 3 months, sometimes 6 months. They don't have the money. So this is, I suppose, where Merck has to be looking in that direction if they really want to have this thing making the kind of impact that is needed. The legacy media of print and television is still important, but in the main, I think concentration has to be on radio to reach people who can't go online. And then the online versions that are there that create networks that allow people to come out and speak without even identifying themselves. Those are the areas where investments, I think, would need to go. I also think that sex education at school and the kind of biology lessons that go beyond the bees and the flowers, but which emphasize the complex process of conceiving and the survival of a fetus in the womb for 9 months, and then safe delivery. I think it's important that that education happens at school from a very young age. And it's got to be education that shows that any minor misalignment in that plumbing system of either partner can result in a serious malfunction, and that when that happens, if science can't fix it, it shouldn't be a disaster either, because indeed, to be a man is not just only being a father. You can be a man without being a father. You can be a woman without being a mother. Thank you very much.